Good evening. In this presentation, I'd like to talk you through the approach to weight management in dogs and cats with obesity. And I'm hoping to try to make this as practical and enjoyable as possible and really give you some useful little tips and hints that you can put into practice within your clinics. So what I want to do is actually go through a series of stages during the process. We're going to assume that you have made the diagnosis of obesity, you've talked to the owner, and they are now on board with the program. So in these steps, we're going to talk through the key things you need to do. We'll begin with setting a couple of key targets. That's the ideal weight and the target weight. We'll spend most time talking about the weight loss process and the weight loss phase itself. And remember, our strategies involve reducing energy intake on the one hand and increasing energy use on the other. But what we must remember when we are managing obesity is that we never cure this problem. So weight management is not just about weight loss. It's key to make sure that we maintain any success that we have. So I'm going to finish up by telling you a little bit about the maintenance phase for weight management and some of the things that you can do here to help prevent rebound. So let's start by talking about setting a couple of targets. So the critical thing we do first is we work out and set an ideal weight and a target weight for the patient that is in front of us. Now, if you read old textbooks covering obesity, you might think these two things are the same, but I want to emphasize first and foremost that they are completely different. So let's just explore that. The ideal weight is actually what I would, term the perfect weight. If you like, it's the beach body weight, the weight in which the amount of body fat mass is optimal for health. Now, the reason this one is so crucial is that it's the weight that we base all of our calorie intake on during weight loss. So we don't use the current weight. We certainly don't use the target weight. We base our calorie intake on the ideal weight. The target weight is slightly different. This can be an arbitrary weight which we're going to set as the end point for weight loss in that patient. So just give you a couple of examples. If we're dealing with a young, fit, otherwise healthy individual who's got obesity, they have most of their life still to live and they don't have any diseases. So we may wish to set a target which is very close to or at the ideal weight. And that might enable them to live longer and prevent disease. If, on the other hand, we're dealing with an older patient who has less lifespan left and a patient that has other illnesses, then of course it's unlikely that we will either extend life or prevent those diseases because they've happened already. So our target here may be more modest, and we know from studies that a small amount of weight loss can improve function, so somewhere in the region of 6 to 9%. So just to summarize, our target we can set arbitrarily to determine what works best to get the benefits for the patient. So to think about it, target weight and ideal weight may be different, and one final time, whatever these weights, it is the ideal weight that we use to base our calorie intake on. Just want to say a little bit about setting the ideal weight now. There are various strategies we can use. The most common one is to base it on the body condition score. So if we take a current weight and we do a body condition score, I prefer to use here, as you can see, the 9-point system. This can enable us to estimate the likely ideal weight in that patient. And this is really the system that we use. It's what we call the 10% rule. For each body condition score between 5 and 9, each one is an additional 10% of extra weight. So with a simple mathematical equation, we can get a rough idea of where ideal weight should be. This is not a perfect approach, but it is a reasonable starting point for weight loss. So that's probably enough about getting things started. Now let's spend most time talking about weight loss itself. And remember, I've told you about energy intake reduction and increase expenditure. If you listen to a previous talk of mine looking at the current scenario of obesity, you'll remember the simple explanation is related to energy balance. And obesity arises when there is a long-term positive energy balance. When we manage obesity, we try to reverse that trend. So that means reducing energy intake on the one hand and increasing expenditure on the other. Let me start by asking you a question. If you could only do one of these two, either reducing energy intake or increasing activity, my question is, which one is most important? Have a think before we move on. If you've got your answer, is it either A or B? Let's now see what's right. The best way to explain this is using an example of chocolate. Now, I guarantee that most people like chocolate. I myself love chocolate. It may concern you to know that a small bar of chocolate, just 100 grams, has over 500 calories in it. Now, I've put on the slide here that it would take me about 5 minutes to eat that chocolate. If I'm being honest, it'll take much less time than that. Let's imagine we've done that, and now we want to think about how much activity do we need to compensate for those calories. If we were to walk at an average rate, sadly, it would take us 2.5 hours to burn those same calories. So what I'm trying to show you is that actually energy expenditure is a very inefficient way of using calories up. Now you might say to me, well, I'm young and healthy. I like to go to the gym and I'm going to go on a treadmill or one of those elliptical type trainers. I'm sure we all know the sort of thing. And I'm going to do a very, very intensive workout here and go as hard as I possibly can. Now, I can tell you from personal experience, having done this, that to burn those calories, it still takes a considerable time. So 50 minutes of flat out activity. If you don't believe I've done this, this here is a screenshot from my iPhone after that activity. And you can see that it took me 50 minutes and 26 seconds. But note also my average heart rate of 155. For a man of my age, that means I'm at anaerobic activity throughout. So not surprisingly, I ended up looking like this. So if you want to know and can only focus on one thing, the important thing really is to focus on food intake, because it is far easier to restrict calories than it is to burn them off. We've actually explored that topic further in a recent trial. This was one we published in early 2019. And this was a randomized controlled trial. And what we did was take some pet dogs, all of which had obesity, and half of them we randomized to having a calorie restricted diet. And I'll tell you more about that strategy later. But the owners were told not to change physical activity. The other half, we asked the owners to increase physical activity, if possible by a third or more, but we told them not to change diet. Over a period of about 8 weeks, we found those that were on the diet-only strategy lost a significant amount of weight, 10% on average. In contrast, those in the physical activity group did not lose weight significantly. Some lost, some gained, but there was no significant difference. So I think this final point emphasizes the fact that diet is by far and away the most important part of the equation. So I'm going to go through some key rules when we're talking a little bit more now. I've told you that feeding is most important and how much we feed. And I want to emphasize that actually it matters more exactly how much you feed rather than what you are feeding. In human nutrition, this may appear rather controversial because a lot of people strongly believe that the solution to obesity is not how much you're eating, but the type of food. Particularly, people will argue that if you either restrict fat or more recently restrict carbohydrate, that will solve obesity. However, the reality is that it is all down to calories. And I'm going to emphasize this with a rather interesting story. This is a story about a man called Mark Haub. I suspect none of you will have heard of Mark Haub. He is a nutrition professor at Kansas State University. And a few years ago, he undertook a rather unique experiment in order to try to determine whether weight loss was the result of calorie intake or the type of food that you were eating. What he did was put himself on a special diet that he called the Twinkie diet. Now, if you've been to the United States of America, you will know that Twinkies are effectively cream cakes. So they are very high in carbohydrate and sugar and high in fat and pretty low in protein. So they would be pretty much the worst thing you could think about eating if you're on a diet. What Mark Haub did was he ate just that diet, but crucially, he restricted his calorie intake. So he ate less than he needed. What he found was he lost weight exactly as you would do on any diet. So he lost 27 pounds, that's about 12 kilos over 2 months. His body mass index normalized, and all his metabolic risk factors went back to normal. So in short, despite eating the wrong type of food, weight loss worked perfectly well because he restricted calories. Now you may feel, well, I'm a scientist. That is just an anecdote, and I don't believe simple anecdotes. If you don't believe that, this is a randomized controlled trial that shows exactly the same thing. In this trial, 3 different diet strategies were tested randomly. That included low carbohydrate and low fat options. And as you can see, weight loss was identical in those 3 strategies. Added to that, this is metabolic syndrome. The improvement in metabolic syndrome was again identical. So both from anecdote and good quality science, we know that actually all diets work if you do them properly, and particularly if we restrict those calories. So, having told you the importance of calorie restriction, I need to now tell you how you do this for our obese patients. Well, in short, you need to focus on 3 things. Firstly, you need to calculate ideal weight, because remember, we base calories on ideal weight, not current weight. Next, we need to have an idea about what maintenance energy requirements are at ideal weight. So these are from the National Research Council, the current guidance for maintenance energy requirements in pet dogs and cats. As you can see, it's about 100 calories per kilogram to the 0.75 for dogs, 100 calories per kilogram to the 0.67 for cats. You don't actually need to know and calculate these, but you just need to know that is basically the barrier. As long as you can feed less than this, you should achieve success. So the current recommendations would be to calculate somewhere between 60 and 80 calories per kilogram to the 0.75 per day for a dog, and 53 calories per kilogram to the 0.711 per day for cat. If you feed those, you should achieve success. I should emphasize for dogs, what you choose depends both on sex and whether or not they are neutered. So an intact male dog, you feed 80. A neutered male and an intact female, you feed 70. Whereas a neutered female, you feed 60. For cats, you don't need to adjust whether they're male, female or neutered or not. You just feed the 53 calories per kilogram to 0.711. Now, that's great. That at least is the principle. You need to understand that. But in practice, you may have limited time. So I would speak to people who supply your therapeutic diets that you use for weight loss, because there's a fair chance that they will have some computer software that will make your job easy. I'm just giving you one example here, some software that Royal Canin have produced. So the first rule, remember, is everything is about getting the calorie balance right. And although I've said that you can achieve success with any diet, I would strongly recommend that you use a weight loss diet. That is because those diets have been formulated to help achieve successful and safe weight loss. And they have various characteristics to help them in that regard. So firstly, they are energy restricted, so they are less energy dense than a standard diet. Secondly, the essential nutrients are better balanced for weight loss. Compared with a standard maintenance diet, there are more amino acids, vitamins and minerals per calorie. So when we're cutting the calories, we're not cutting everything else. Added to that, they have things like L-carnitine and increased protein content, and that helps to preserve lean tissue or muscle mass during weight loss. And finally, both the protein and other macronutrients such as fiber can have an impact on satiety. That's the feeling of fullness after eating. And what we know from scientific studies that I will show you is that the optimal balance is a high protein, high fiber weight loss diet. To illustrate that, here is one experiment, and this was published in 2007 in Journal of Veterinary Internal Medicine. In this study, a group of dogs have been offered 3 different diets: a high protein diet, a high fiber diet, so that's in the middle and on the right, and then a diet that has both high protein and high fiber within it. And they're allowed to eat what they want over 4 successive meals at hourly intervals. What you can see is, as dogs consume more across those meals for all diets, the amount they consume is least. But on the high protein, high fiber diet, they eat far less overall than either of the other 2 diet strategies. So that firmly tells us for dogs, high protein, high fiber diets are best. Cats are slightly more complicated. Remember, cats are never quite the same. And there are some challenges with going high protein and high fiber. Firstly, if we increase fiber too much, the diet becomes unpalatable. And of course, we want to ensure that they will eat the food, because otherwise there could be problems. Secondly, in contrast to dogs, protein, as the slide shows you, actually increases food intake rather than decreases. It's one of the big drivers of food intake in cats. So we still need to increase protein and we still need to increase fiber, but in reality we can only be modestly increased in both, and that provides the best balance. Right, some more rules. We're going to talk more now about how we feed our pets, whatever the diet, and a really, really important rule for you is to ban the measuring cup. I would strongly advise you to stop owners from using measuring cups to measure out food. We have done studies where we know, firstly, depending on the type of cup, the lines on the cup are not accurate. The worst offender, and I'm not going to mention any names, the actual portion for 50 grams was 100 grams. You were feeding almost twice as much food. So of course, if you spent all that time doing your calculations, a measuring cup could wreck your success. Added to that, the same person tends to measure different portions out each time they do this, and different people are more variable still. The interesting thing, however, is that between 70 and 80% of the time, this is an overfeeding. For some reason, we psychologically tend to put more in if we're not sure what is correct. So not only are they inaccurate, but we tend to feed more. Finally, if we tell owners to use cups, they may not use the measuring cup intended for that food. They may use a totally different cup within their kitchen. So for example, this is my kitchen at home and I'm showing you 2 different teacups. On the left is the standard teacup. On the right is actually my teacup because I like tea. I'm British after all. But what you can actually see is that volume-wise there is a massive difference. So our understanding of what a cup is can be rather confusing. So far remember we need to think about getting calorie intake right, and remember we need to think about a purpose formulated diet. We don't use cups Instead, we need to use a more accurate measure. So the best thing is to try to get owners to use electronic scales because they are far more accurate for the purpose. Next rule, I'm going to go a stage further here. I would suggest we ban the bowl. Bowls are not a good way of feeding any dog or cat, not just those dogs and cats that have obesity. I don't know who came up with this as a strategy, but really we can do a lot better. The problem with this is we typically feed our pets, well, dogs maybe once or twice per day, cats probably similar amounts. Has anybody timed how long it takes a dog to consume their food? If not, take a look at this video. This is a video of 3 Labradors eating their food. So you can see the Labradors are eating food at different speeds. I'm not sure if you're timing back at home, but I think you can see the Labrador on the right is more or less finished, just clearing up the last bits. That was probably about 15 seconds. And remember, that dog will have had half its daily food in that time. It's now got to wait another 12 hours before it sees any more food. And note here, another problem with rapid consumption is slower dogs then tend to lose out because, as you can see, the dogs like to help one another with their food. So for me, bowls are not a good way of feeding pets. They're particularly challenging, of course, if we have dogs or cats on a weight loss program, because remember, we're restricting intake and they're going to be eating less. So we need to try to make the food last longer. And the way we do that is to use various forms of puzzle feeder. Some of these, as you can see here, are toys. They're hollow toys and you put the food inside. They come in various shapes and sizes. Others are more modified feeding bowls, such as that green one, where the dog really has to work to get the food out. The beauty of these sorts of devices, and you can use them for dogs and cats, is that you can put a far smaller amount of food out each time, maybe only a 1/5 or a 1/10 of the daily food, and it will take those dogs far longer to consume that food. Added to that, we know that dogs actually prefer to work for food rather than having it offered freely. They get a lot of enjoyment with the feeding process. So for me, I think we need to use puzzle feeders as far as we can rather than bowls. One other thing before we move on from food, beware of extra food, treats and tidbits. The problem with this is that owners often don't take them into account when they feed their pets, and this can be very damaging to success for weight management. Remember, food is love. The number one way we like to treat our pets is by giving them food. And typically what we will do is offer them human food, things from our table or other things. And they are typically quite high in calories, high in salt, high in fat. So they're the wrong thing for a weight loss program. One of the other challenges that we face is that owners misunderstand the contribution that they make. They may look at a piece of food and think it's a tiny piece and therefore is not going to have any impact. However, if they've got a small dog or a cat, even the smallest of treats will carry a massive calorie burden. Let's look at an example. Let's imagine we have a cat and we want to feed that cat a small tin of tuna as a treat, just about 100 grams. May not seem much. Let's think, if that cat were a person, how much food do you think that person would have consumed? How much tuna? And I want you to think about this before I tell you the answer. So, does the person, if they were eating an equivalent amount, do they eat 2 tins, 4 tins, 5 tins, 7 tins, or 20 tins? Have a think. Well, if you work it out, 100 grams of tuna actually is about 40% of maintenance energy requirements for a cat. 40%. So the first point there, of course, is that small treat has contributed a massive amount to that cat. 100 grams of tuna is actually only 6% of maintenance energy requirements. So if you do your maths, the true answer there was 7 tins. Not as much as 20 tins, but still, 7 tins is a lot of tuna. And I would challenge any of you out there to consume that amount tonight after this presentation. So, one of the things that we have to think about is trying to avoid treats. And our preference is to try to stop treating altogether, but recognise many owners will not be willing to give that up. An alternative would be if we're using dry food to reserve some of the kibbles and ask the owner to use those as treats instead. Because in reality, the dog or cat is craving the reward. It's the act of giving the treat that matters rather than what the treat is. However, some owners will still not be happy because they want to give something different. So really, what you have to try and do is substitute high-calorie treats for things with a lower calorie. And the best things are watery vegetables, such as this example here, which is courgette or zucchini. Now, interestingly, dogs love zucchini. Cats also love zucchini. This is just being cooked in the microwave. And if this video will play, what you can see is a cat coming along here. So as we can see, cats love zucchini. And the beauty of this is that in a typical zucchini, there's only about 20 calories or so of food. That's in a large one. So the cat is coming along here. This is cooked zucchini. And this cat loves to consume that zucchini. And the beautiful thing about that is that this doesn't contribute many calories. So a 100-gram large zucchini is only 20 calories. You do need to take that into account, but just a small amount of zucchini will go a long way. And it's far better that pets consume this than consuming some of those other treats that owners prefer to give. Some other challenges. It's very common for people to have problems with multi-cat households because not uncommonly you have lean cats living with cats that have obesity. And the challenge then is, how do you restrict your cat with obesity and put them on the weight management plan whilst at the same token allowing the lean cats to consume food in the way they want to? And most lean cats are grazers. They need food available the whole time. Well, I have some solutions for you. Firstly, this is an example here of someone who has modified 2 cupboards, as you can see, with cat flaps. And these cat flaps recognize the microchips of the different cat. So that means what you can do is put food into each of the individual cat's feeding stations, and that will enable them to eat what they want when they want it and to prevent that food from being consumed by the other cat. So that obviously is challenging because you need 2 cat flaps and you need to be prepared to modify one of your cupboards. The same technology for the microchip cat flap has now been put into a bowl. So these bowls will open and close when the right cat is present. give you some examples here with some video. So this black cat and this tortoise shell cat live together. The black cat is lean and is a grazer, so needs food freely available. And this cat flap has been programmed to recognize the black cat. Now, the other cat needs to go on a weight management plan, so we need to use other forms like puzzle feeders and restricting food. When they try to consume food from this cat flap, the lid will close, so they will not be able to consume food. And actually quite rapidly, they then learn to ignore that station. So that's a fairly high-tech solution to solve this multi-cat household problem. If you want a cheaper alternative, here's an example. This is a cardboard box, and what we've done is cut a small window out of it that only the lean cat can get through. Once again, you can leave food out there and the larger cat is unable to consume it. Other alternatives might be to place food on a high surface, and that would be if the larger cat can't climb up there, and so on and so forth. So we've talked a lot about restricting energy intake, and that is the main approach and really the most important one to focus on. But let's not forget that activity will help as well. So this slide reminds me I need to start talking about activity. And it's always rather amusing, I find, that people are attending here a fitness centre and they're choosing to take the escalator there. It's a kind of mixed message. Anyway, benefits of exercise. If you remember from early on, what we told you was that there's really no major effect alone on weight loss. That's because it's very difficult to actually do enough activity to burn a significant number of calories. And I told you about our randomized controlled trial that demonstrated just that. But however, let's not forget there can be other benefits which are important. Firstly, exercise may help to preserve lean tissue, that's muscle mass. And this was demonstrated by some very elegant work done at Copenhagen University. Here they ran a trial where they compared dogs that were on a diet-only weight loss plan with those that had both diet and hydrotherapy. That's using one of these underwater treadmills. What they found was that in fact there was no difference in rate of weight loss, which again confirms the fact that exercise itself doesn't bring added benefits for weight loss. However, those that were on hydrotherapy preserved their lean tissue mass compared with those that were just on diet alone. So certainly activity is very good for helping with that. Now that's the good news from this study. Sadly, there is a little bit of bad news, I'm afraid, and that is that actually in order to achieve this success, the dogs needed to do 3 lots of hydrotherapy per week. And that was a massive, massive commitment, to the point that actually they found it difficult to recruit patients to the study because most owners were unable to give up that amount of time. And of course, there's a significant cost involved. The other thing they had, which was challenging, was that many dogs and cats with obesity are unfit, and they were simply not able to do the amount of activity that they wanted. But though that being aside, it does suggest that for all our patients, we should try to improve activity if possible. A final benefit, which is very important, is that this is actually a positive reward. The trouble sometimes with weight management plans is they're seen as very negative. We're putting our dogs and cats on a diet, and that's a negative thing for us. The English word diet, well, the first 3 letters spell die. And it's kind of a negative way to look at it, but that's how people think about diets in general. So the advantage of focusing on exercise and activity is this is something positive that the owner can do. So what we would typically do is we would look at the individual, see what exercise and activity they're doing now, see what is enjoyable, what's possible for the owner, and of course take into account the circumstances of the individual dog. So we need to say what other illnesses and things they may have. And we would create a tailored plan, which might be walking, play activity, hydrotherapy or what have you, which is best for that patient and that owner. One final thing we try to do is try to be as consistent as possible. I think it's easier for metabolism if activity doesn't change too much on a daily basis. So that's dogs, and it's easier to increase activity in dogs because owners are used to playing with them and used to walking them. But of course, cats are more challenging. Typically, cat owners get a cat because they don't have time to look after a dog, and added to that, it's really not within their mindset to be exercising or playing with their cat. So here, what we have to do is make use of the physiology of the cat. The good thing here is that cats are sprinters. They're not marathon runners. They are used to short, frenetic bouts of activity. So when we start with increasing activity in cats, we'll ask an owner just to do 2 short activity sessions of only a minute or 2 at a time. That's actually enough for a cat. They wear themselves out and you need do no more. So the hope is that that is achievable even with cat owners that have busy lives. The best form of activity are using these fishing rod type toys. It can create rapid movement, which is what the cat likes, and they need to have these short sessions, as you can see here. Now, sometimes cats will get bored with the same toys, so it is important to have a range of toys to enable them to play. The most useful thing for monitoring success actually is weighing. We would typically recommend weighing patients every 2 weeks at the start of a program. What you're looking at is making sure there is a change of weight, and 2 weeks is enough for changes to be seen, but crucially it is not too much or too long that makes owners have trouble with compliance. So we see them every 2 weeks, we weigh them, and if necessary we might need to make adjustments to our program. As well as weighing, we can use other things to monitor, and these are more for illustrating to the owner that success is happening. So one thing would be to use tape measures, and I typically use measures around the chest and the abdomen. And what you can actually see here, if you put the tape measure in the right place, is that the chest and abdomen girth decrease in a similar sort of manner to body weight. Whilst it's not as accurate, because of course you can pull that tape measure much tighter, or it may be positioned in a different place each time, it's a reasonable guide just to highlight further that the body shape of their patient, to an owner, the body shape of their pet is changing. Another great way of illustrating success is through photography. I would recommend you do occasional photographs, not all the time, because this will demonstrate that success. And if you can, like in these examples, try to take photographs in a same position. And that's really the best way of showing that success. A final aspect of monitoring, which I would say is very important, is to try to encourage the owner to keep a diary of what's going on. And this is an example of a diary that we use at our weight clinic at the University of Liverpool. So we encourage the owners to record food given and food eaten, the activity of the patient and their overall well-being. And the column on the right, if you look closely, is what we call a confessions column. So whilst we would discourage owners giving too many extras, I would far rather, if they have to do it, that they're honest about it and they record it, because that will then help us to judge whether or not there's any problems with the program. Evidence from human studies suggests that people who keep diaries, food diaries, when they're on a diet, do better with weight loss than those who don't. We don't have evidence from dogs and cats, but I suspect the same may well be true. And as I say, seeing this evidence will really help us, because if we see a patient back 2 weeks after we saw them last and they've not lost weight, we're going to be inclined to make an adjustment to, for example, the food that we're giving. But if we see that the confessions column has a lot of extras in it, then we may want to think about, well, perhaps we don't need to adjust after all. Perhaps we just speak to the owner again about those extras and try to get that back on board. One other thing we can use for monitoring, again, if available, is software, where we again plug in the numbers and it will tell us whether or not the program is on course, how quickly the patient is losing weight, and whether any changes to the protocol is required. My general rules are to reduce food intake if weight loss slows down. Typically we would drop by about 5% of food intake and then carry on following it up. The other thing from a monitoring process is always to try to be positive about everything, try to be encouraging, because owners will find it difficult, and try to encourage them to make the next appointment before they leave your clinic. They're more likely to return if you do that. Furthermore, if clients don't come back, give them a phone call. They may have been finding it difficult, and it might be that a simple conversation at that point will actually help to get them back on board and stop them from giving up altogether. So we're at the end of the presentation now. We've talked a lot about weight loss, and what we tend to find at our clinic at Liverpool is that process on average takes about 8 or 9 months, but can vary depending on how much weight a patient needs. Don't think, however, that the job is done when that patient reaches their target weight. If anything, the hard work is still to come. I would far rather a patient lost half the amount of weight it needed to, but kept that weight off, than if it lost all of the weight and then put the weight back on. So focus as much effort if you can on keeping that weight off. Why is this so important? Well, studies in people show that weight regain is very common after dieting. In fact, most people put weight back on in the long run, and in fact, some people gain more weight than they originally lost. So sadly, it is something that we fail at as often as we succeed. We've looked in dogs and cats, and we found a similar phenomenon. In pet dogs and cats, it's not quite as bad, but we find about half of the dogs and cats that go on a program regain weight again. Many of them don't put all of the weight back on, they only put a small amount back on, but nonetheless, that's something which really challenges our success. There are certain things we can do to minimize this, and one is to continue with the weigh-in process on a regular basis, even during the maintenance phase. So if you can encourage the owners to come back, that will really help. Another thing is to actually try to encourage owners to stay on the same diet, because we know that Dogs that remain on the weight loss diet during their maintenance phase are 20 times less likely to regain than if they actually change to a different type of diet. So the weight loss diet shouldn't really be thought of as weight loss diets only, but weight management diets. The same characteristics that help a dog or cat to lose weight during that weight loss phase can be used to prevent the regain in the future. So if you can convince the owner to stick with that diet, you just feed a little bit more to maintain them, then that will actually help to prevent this regain. And just some very brief tips on how to do this. You continue, as I say, with the weight loss diet, but you carry on seeing them initially every 2 weeks, if you can. Each 2 weeks, increase the food by a little bit, 5 to 10%. And if they're still losing weight, increase again and again until they're stable. Normally it doesn't take long before you find that they stay stable. And once they're stable, you can start to extend the intervals of checks, moving say to 4 weekly, then every 3 months. I would ideally recommend at least every 6 months long term if you can manage it. So that brings us to the end of this presentation. I hope you've enjoyed it. I just want to briefly remind you about some of the key points that I made. Remember, at the start you need to set those 2 weights, the ideal weight and the target weight, and remember that they differ. The ideal weight is the perfect weight, and I can't emphasize enough, it is the one that you set the calorie intake on. The target weight is the more nominal weight end point for weight loss based upon the goals that you have for that patient. Remember, weight loss is about reducing energy intake and increasing energy usage, but it is overwhelmingly important to reduce energy intake. Get the calorie intake right, use a weight loss food, measure it out accurately using scales, avoid bowls using things like puzzle feeders, and of course be careful about treats. For activity, do your best to increase it. It won't help with weight loss, but it might help, say, preserve lean tissue, and it's positive. And finally, for maintenance, don't give up here. Carry on seeing those patients, and if possible, stick with the same weight loss diet. Thank you very much.